Professional athletes from all major sports rely on the benefits of chiropractic care. And I'm not talking about just our human sports figures.
Similar to a human chiropractor, an equine chiropractor actually evaluates the spine and the nervous system of a horse. The skeletal system consists of the spine and the the joints of the body, the shoulders, the knees, the hocks, the stifles. And so what we do is we look for balance, symmetry, we look for pain reflexes, and we look for how the body in general moves and functions the way it was intended. We look for issues with mobility, we look for pain behaviors, we look for gait disturbances, we look for weakness, we look for muscle imbalance, and by finding those we can usually apply some sort of manual therapy, some sort of correction to the area to restore normal movement in the joint, decrease pain, increase range of motion, decrease muscle spasm. I get calls from a lot of horse professionals as well as animal owners and things like that. You know, oftentimes we'll get a call from the trainer or we'll get a call from the owner where the horse isn't performing just right. They might be running on the left line, they might be having problems with cornering or not cornering appropriately, they might not be holding their head right, they might having more issues with choking, things like that, oftentimes gait issues, or a normally calm horse can all of a sudden become a little bit of a handful with some sort of pain behaviors. Oftentimes they do the veterinarian check first, then we also recommend that they check with the dentist, we also check with the farrier, make sure some of the simple things are worked out. Oftentimes they'll do injections in the joints, stifles, hocks, things like that. And oftentimes when they just don't know what else is going on, I'll get the call and then I'll come in. Of course, I like to look for hoof placement. I like to look for symmetry in the pelvis as it rocks back and forth. We want to see how the rib cage moves back and forth. We want to look for things like head bobbing and just balance and stuff like that. We also look how they're walking. Is one of the hoofs turned out? Does it look like they're uncomfortable? Does it look like they're unable to get a full walk? Jan will back them up for us. That'll give us a better idea of just how the stifles and the hocks are working. We'll take a look. We then take a look at the overall look of the horse. How's the coat? Is there a nice sheen on the coat? Does the horse look underfed, overfed? Are there any kind of obvious lesions or anything going on? Does it look like the horse has any type of impairment? A human body has 206 bones in it. An equine has 205. We actually share the same number of vertebrae in the neck, which is 7. Humans have 12 pairs of ribs, and horses have a few more. They actually have 1 extra lower back vertebra. But they're stacked just on top of each other, just like we do with humans. So exiting between these adjacent vertebrae are these delicate nerves. These nerves go to the muscles, the tendons, the ligaments, but then they also go to the internal organs. So what happens is when you get misalignments, or you might get mobility issues where a joint could be fixated or locked in place, or it could be hypermobile, you get changes in that area, creating inflammatory response, creating muscle spasm, and then leading to gait dysfunction and then motor dysfunction. Very similar shape as a human. We've got pelvis, sacrum, sacroiliac joints, lumbar vertebra. Then we have what are called the thoracic vertebra, this area they call the wither area, and then we have the cervical vertebra ending up at the skull itself. So I'm going to apply a little pressure, and you can see there's a little bit of reactivity, okay? So sometimes you get a little pain response, okay? You can go up the spine and see what's going on. You can actually see, so he's having a pretty good response. You can see some muscle twitching. I'm going to come out, check on the pelvis, okay? Now I'm going to run right down on the lumbar spine and see if we can find one of the vertebrae. So you can see there's a little bit of pinch right here, and as I come up, not as pinchy, okay? So I do like to identify myself when I first come to the barn as I'm not a veterinarian, but I'm part of the healthcare team. The veterinarian handles the veterinarian problems. The farrier obviously is dealing with the hoof problems, and we know with the equine dentist. How do we interface this? I'm just part of the team. I deal with the structure, the axial spine, the appendicular or the appendages of the spine, and we actually work as a coordinated team. Standardbreds have a propensity to having trouble with their knees. So he's doing pretty well in this. Shoulder looks real good. So one of the things I'm going to then take a look at, I'd like to see what his teeth look like. So when we look at the teeth, we want to see that the teeth are lined up, the spaces, and his look real good, okay? We usually get called in within a week or two of a big race. And so oftentimes what the owner comes in and says, you know, he's one of his hind limbs is crossing over. The back end seems to be tracking one side versus the other. His gait has shortened. His rear foot is now striking his front foot, things like that. They start to see some sort of mechanical problems. So they might go in, have it checked out by the veterinarian. The veterinarian then says, you know, this is actually a chiropractic problem, and then they refer them to us for some easy correction. So we'll see things like pelvic dysfunction, sacroiliac problems. Young horses have joints in the smaller part of their spine that are called the intertransverse joints. With the necessity for them to propel themselves forward, they also get they can sometimes get a pinching in their lower back, which is easily remedied. You know, we also see, we see a lot of horses that have issues where their poll, which is their skull or their first vertebra, are fixated. So as a result, they're very uncomfortable in the head. They do a lot of head tossing. They have a lot of behavior issues and stuff like that. And usually once you free up the poll and the pelvis, the horses feels like their body is moving more fluid and more dynamic, and it makes them perform better. We're going to take a look at his poll, see if he's got any fixations in his poll. Going to rotate around. And so he's a little right-sided fixated. So I'm going to take some tension out, and I'm going to make a pressure right in that area there. Come right in, press it down, pelvis, press it down. I'm going to pull on the hamstring muscle. Going to help release the pelvis. There he goes, release the pelvis. Good. So Standardbreds get a lot of issues with their shoulders. So one of the things we've got to do is we've got to encourage him to stretch his withers out. That was a wither stretch. We're going to come right in this area here. I'm going to ask him to stretch his shoulder for me. I'm going to hold it. He's going to lean in. He'll lean in for me. Come on. There he goes. I'm going to cross the midline with it. Let's place it on top of me. Good. Each animal responds differently. The way that the spine is oriented in a human is in an upright manner. In an equine, in animals, it's going to be in a horizontal manner. So when we make a correction, the animals usually, what we would say, hold their correction much longer. I usually recommend that possibly they rest the horse for just the rest of the night or even one day if needed. So usually within 24 to 40 hours they know a significant improvement has occurred. My office staff usually follows up within a few days to see what the performance is like, and at that time we determine whether or if another visit is necessary. Some people who come into my practice, they like to get checked on a monthly, quarterly basis, some on a bi-weekly basis. Some horse owners find that they get a better results with consistency of care. We have a number of barns who have 15, 20 horses and have a number of people working for them, and we put on little seminars for the barn staff, and we show them what is going to be important for between visit care. And we find that when they follow through with that, just like a human who does their stretching and does the things that they're supposed to, the need for ongoing treatment, the time gets extended, and their treatments hold much longer, and they get great benefits in the long run. As you can see, I think he's enjoying it. So he's essentially done with his adjustment for today. I would then offer an adjustment for the owner. After we figure out what's going on, we find the areas of the horse's anatomy that needs to be corrected. We make the correction. We do some stretching, some muscle relaxing. We give some exercises while we're in the barn with the owner. And then what we'll do next is we always offer a chiropractic adjustment for the human, also being both the human and animal chiropractor. And you would be surprised how many folks can't wait for us to show up. A lot of my clients will say, I'm going to get adjustment. If a horse gets adjustment, that's okay, but I know that I'm here. And we do treat a lot of the teams, and we keep them in good shape, because most of the organizations we see, they are spending so much time and money to take care of their horse. Sometimes they don't recognize they need to take care of themselves. So that's something we do, is we offer. It's all included in the cost of a visit. So a lot of folks do look forward for us coming to give them an adjustment also. Being in a human and animal chiropractic for 31 years, I've had the opportunity to treat an awful lot of different types of animals, dogs and cats and things like that. Some of the most interesting animals I did treat was recently I had a golden retriever puppy that was paralyzed that came into office, carried in by one of my patients. I've had the opportunity to treat a paralyzed deer. One of the veterinarians called me. A deer had been struck by a car, and had dislocated one of its thoracic vertebrae. So I worked alongside with the vet. We were able to get it up and walking. We treated a potbelly pig that was paralyzed from mid-waist down after being injured in a farm accident. And so in my human practice, Monday, Wednesday, and Friday we do humans. On Tuesdays, Thursdays, and Saturdays we do dogs, and we see some interesting ones that come in little carts, and we have some that come in with hip surgeries and back surgeries and stuff like that. And one of my greatest pleasures is to be able to work with the local veterinarians to help improve the life of these animals, because we all know how much we love our pets, and we all know how much we love all the animals that are in our life.
Thank you so much to Dr. Baldt for taking the time to show us and tell us about equine chiropractic therapy. What a great interview. For more information, you can contact Equine Wellness Solutions at 302-945-4575.